Hi, my name is Carla Racisa, and I'm presenting a case study on bulimia and anorexia. The book that I read was called Wasted. It was written by Mariah Hornblacher, and she talks about her battle with bulimia and anorexia. There were many socio-cultural factors that played into her development of her eating disorders. She wrote that many of her childhood memories were all related to food in some way. Her parents played a big role in her development too, because of their personalities. Her father was the enmeshed parent. He was overprotective, and he was very needy and attention-seeking. He would often take Mariah on ice cream runs and get other special treats too. During meal times, he would often overeat, and then he would say to everyone, "Oh, I need to go on a diet," and this was a weekly pattern. Her mom, on the other hand, was the totally opposite of her husband. She was more cold and distant. When it came to meal times, she was picky and would barely eat any food off her plate. Mariah also had many images of thinness when she looked at billboards, on TV, and magazines. Many times she would read a magazine and just because she wanted to get the diet tips out of it. These are some of the socio-cultural factors that were precursors to her development of bulimia and anorexia. Mariah started showing symptoms of bulimia at a very young age. She was only 9 years old. According to the Diagnostic and Statistical Manual of Mental Disorders, or for short, DSM, the essential features of bulimia is binge eating and inappropriate compensatory methods to prevent weight gain. Binge eating occurs when a person eats a large amount of food in a very short time period and is accompanied by a sense of lack of control. Many times individuals after they binge eat, they would often use the inappropriate compensatory methods, like purging, vomiting, or misusing laxatives or diuretics. Many individuals would excessively exercise too. Mariah displayed all these symptoms and diagnostic features of bulimia. For example, one day after school, she decided she wanted to go to the grocery store and buy as much junk food as possible, and then ate it all at once in a very short period of time. Then she walked to a friend's house, and her friend ate all the cookies and ice cream in the house. And then when she got home, she went up to her bathroom and threw everything up. Then went back downstairs and had dinner with her parents, and after she got done eating, she went back upstairs to her bathroom and purged again. Binging and purging became a daily occurrence for Mariah for about 6 years. Then she decided she wanted to starve herself and become anorexia. According to the DSM, the essential features of anorexia are that the individual refuses to maintain the minimal normal body weight. They are intensely afraid to gain weight, and they exhibit significant disturbances of their perception of their own body weight and size. Females with this disorder often stop having their monthly periods. Weight loss is accomplished primarily by reducing their total intake of food. For example, when Mariah was at her lowest weight in the low 60s, she was maybe only eating one bagel and a small cup of yogurt a day. Also, many individuals exercise excessively. When Mariah was attending the Arts Academy in Michigan, she was running up to 25 miles a day on a daily basis. These symptoms led to Mariah being hospitalized several times. During her hospitalization, she mainly received behavioral and humanistic treatments. During Mariah's first hospital stay, she had to be monitored at all times. The nurses were there when she ate, even when she went to the bathroom. They were there. During meal times, the nurses would calculate how much she ate, and if she did not eat enough, she was forced to drink some Ensure. This part of the treatment was considered the behavioral treatment. The nurses were using operant conditioning. According to the textbook, operant conditioning is a process of learning in which the behavior will lead to satisfying consequences or rewards that are likely to be repeated. So the rewards can be either positive or negative. In Mariah's case, the Ensure was the negative reward. So therefore, if Mariah ate enough of her food, she was reinforced that if she ate enough of her food, she wouldn't have to drink the Ensured. What lacked in Mariah's treatment, I thought, was changing her cognitive disordered thoughts about her body shape and size. I thought the doctors concentrated too much just on the behavior therapy. But today's typical treatments of cognitive behavior therapy, or CBT, are very good treatments for bulimics and anorexias. The goals of CBT are to make the person not to purge and eat all the food. They want to reduce their concern over their body weight, size, shape. They want to make sure the person understands what triggers their binging or starvation. And then they want to help the person develop proper coping techniques. During Mariah's stay at Lowe's house, her treatment plan included not only behavior therapy but also humanistic therapy. The purpose of this treatment was to help her gain more personal growth or self-actualization. So her assignment was just to play. A little boy named Dwayne would always play with her, and as their friendship grew, Mariah began to learn to be more trusting of others. She began to gain more concern of other people's welfare, and besides just her own. Other typical treatments that Mariah received were group and family therapy, antidepressants, and nutritional counseling. The one thing that Mariah failed at was the most important key in overcoming her eating disorders, and that was not maintaining a long-term therapy plan. So Mariah's prognosis didn't look so good. She had been in and out of hospitals numerous times, which increases the risk of relapse. In fact, she relapsed right after her book Wasted was published. Typically, people who suffer bulimia achieve full recovery, about 89% do. But on the other hand, anorexias have only a 33% chance of fully recovering. 50% of them improve, but there's a handful of 20% that will be battling anorexic symptoms for years to come. So it's vital that a person maintains a long-term treatment plan. I would recommend this book to anyone who has an eating disorder, their family members, and anyone who has gone as far as letting this dangerous thought cross their mind. Thank you for listening to my presentation. Bye.